Hi, guys. Happy Thursday. Thanks for joining me today at around lunchtime. I'm going to be sharing a little bit about the best way for you to prepare for your injectable appointment, whether that's dermal fillers, neuromodulators, whatever it may be. I think that it's something that we often have a lot of patients inquire about. And then over the last 15 years or so, I've learned some nice tips and tricks for patients so they are far more comfortable. So, first, I want to start with, oh, give me one moment. Amazing. All right, thank you. All right, first, I want to talk to you a little bit about what you can expect when you come to Fulcrum Aesthetics and Surgery. Before we ever talk about filler, neurotoxins, lasers, surgery, or any treatment for that matter, you're going to receive paperwork to fill out via text or email. Please fill out your paperwork, all the questionnaires and consents prior to coming in. It makes the flow so much easier. And our scheduling time is scheduled for the face-to-face, the consultation, and treatment. So if we have additional paperwork to fill out that hasn't been filled out ahead of time, and then we're reviewing paperwork, more and more questions, it ends up delaying your treatment and might be just a consult that day and we can't actually treat you. Or it will push back another appointment. So that's just our request ahead of time. It also gives you the opportunity to start making notes when you're reading through the patient questionnaire, when you're reading through consents, you can make notes on your phone, bring that in, and we can address those questions for you immediately. So you're at ease, and then we're all on the same page. The morning of your treatment, you can expect to receive a text from our front desk. And a text from our front desk is going to include, they're going to ask you what your beverage of choice is. I think we have the best tasting water in the city. It's Fulcrum bottle. It's delicious tasting. It really is. And we also have a wide variety of coffees, lattes, cappuccinos that you could also select. So when you arrive, you're going to have your beverage of choice handy. And then there's also a warm hand towel with a little lemon oil in it. Generally, it's either lemon or eucalyptus oil. So you can cleanse your hands, grab your beverage of choice. If you've texted us back, little caveat, if you have marked no text or email marketing, we cannot text you. So if you'd like to receive that treatment, please do not check off that we can't text you. Otherwise, we'll just see you when you arrive and ask you, and that's about it. Okay. So it's important for you to understand what we're actually looking at when you come in for the consult. One of the things that we use in our practice is advanced imaging technology that allows us to see beyond the skin. We can evaluate the underlying anatomy, your bone structure, fat compartments, muscles, vascular system, that really all work together to create your facial shape and support. The reason why it's so important is because the face doesn't age all at one time, right? In one area. Patients often come in and say, I hate my jawline, I hate my under eyes. But aging is really a full face and neck process that includes changes to the bone, fat, skin quality, muscle activity, and they all influence one another. So rather than chasing one individual problem, our team is trained to give you a full face consultation. And also moving into that, we'll do full body wellness. So we have a functional medicine expert, we have a menopause and wellness expert as well, and we have a plastic surgeon on staff. So that means that we aren't going to just take a cookie cutter approach. And if it's something that we cannot achieve, your wants we can't achieve with a non-surgical approach, we're going to give you a referral to someone else in our department to help you achieve your goals. So this is what our Aura 3D skin analysis looks like. This This is Howie, one of our surgical MAs. This is on the left-hand side of the screen is her before, the right-hand side of the screen is her after. She, just so you're aware, had 4 syringes of filler between these two images. So 4 syringes is a very small amount. And as you can tell, she looks better. She looks slightly better, but it's hard to put your finger on it. And that is really what we're looking for. That's when you know you did good work. When someone says, you just look better, but I can't really tell exactly what you had done, right? And that's our goal. This will show you the volumetric changes. You can see exactly on the right-hand side where I placed the filler. And I really built out her chin, her midface. Right here is called the piriformis, and it's where there's maxillary retrusion of the bone. And bringing that forward really helps patients look more youthful. So, how do we know we should approach those areas? This imaging really helps us because it actually will line up and measure the patient's faces into thirds for us. So we can see gross asymmetries. This right here is a vector and it's showing us what changes were made. And in her forehead, for example, I wanted to reduce appearance of the length of it. You can't reduce the size non-surgically, but there are some tips and tricks that I can use injectable wise with neuromodulators. And so you can see her forehead was slightly moved down up here. And then along her chin, I wanted to project outwards and down a little bit more. And so it's nice because these vectors will show us what areas we brought up and out, down and around. And it's very important for our treatment planning that we have these tools ahead of time. And it's nice too for patients to get to see the results. Some patients will say, oh, I don't know if I notice a huge difference. That's great. But we have this imagery to also review it with you afterwards. So this is skin analysis. So this is great for our skincare. It tells our estheticians where the majority of the sun damage is. Is it brown? Is it pigment only? Is there vascularity underneath it? So that helps us tailor our skin care guidelines for you. So we might recommend azelaic acid, we might recommend retinol, we might recommend our Koji edit pads because of all of the pigmentation that you have. Azelaic addresses reds and browns in the skin. So there's a reason why we're asking for this information. And it also is nice because it will show us the depth of it. So the majority of the time when you have sun damage on your skin, it's through all 7 layers of your skin. And what we're addressing with a topical solution or a neuromodulator, or excuse me, with a laser, it's usually the first 2 layers. We can't get through all 7 layers. So what we do is we get to track the level of sun damage and or clearance of that pigmentation over time with our recommendations. And it helps us verify that we're also on track and moving in the right directions with our recommendations. All right. What I think is very helpful for me as an injector is if you can bring a picture of your shelfie. So, what do you use at home for skincare? I can build out your face, I can build out your jawline, I can make your portions even and optimize your overall aesthetic. But what I can't do in my chair alone is treat your sun damage, ruddy skin, scarring, acne. So what I will ask for is what are you using at home so we can really ensure that the injectable treatment that this investment that you just made is looks its best, and we also help protect your investment. I want to know what skincare you're using. I want to clean up that skin. I want to make sure that there's increased luminosity so the light reflex off of your skin is pristine. So please bring in a picture of your shelfie so I know what skincare you're using so we can make the appropriate recommendations or send you upstairs to see one of our estheticians. I love seeing old pictures of yourself that you like. I don't love, caveat, I don't love pictures of yourself with filters because that's an unrealistic expectation of what we could or actually really can't achieve. Everyone brings in pics of of themselves filtered. But if you're trying to filter like the nose shape, make your eyes bigger, I can't do that non-surgically. So it that for me is a nice let's pause, let's sit down, educate, and set expectations on what a injectable treatment can actually offer. And if your goals are so aligned with bigger eyes, smaller nose, well, I'm probably going to refer you to our plastic surgeon because we can get you there, but I can't do it myself. So it's very important for me to see pictures that you love of yourself because it helps me understand where you're wanting us to go. And it helps me then create a path of how we get there, whether that's non-surgically or surgically. So lip and face goals, always helpful. And then another point is 100% of my patients say I want natural. Every single one says, I want natural. Natural is very subjective, is what I've learned over time. Everyone with neuromodulator says they want natural until they want to see results, which means we've got to freeze your forehead if you want that wrinkle to go away, right? Natural, if you're saying you want natural neuromodulator, true natural results is you're moving, you're wrinkling. So it's one of those discussions that we'll have over time. And when I see photos, I can say, okay, is this natural to you when you're raising your eyebrows and you have a little bit of movement? You want just a little bit? Great. Just so you're aware, that means it'll probably last you 6 to 8 weeks to give you a lighter dose, right? There's a dose response curve that I have to meet in order to relax those muscle groups. So what we'll be discussing then, we're going to discuss your goals, your concerns, the overall look that you want. And in your own words, I like to hear what you want and why you're coming in. Is there a big event? Is there a wedding that's coming up? Is there a graduation that's coming up? We'll talk about your medical history, prior treatments that you had, and then that's when I'll go into your full face analysis. I like to start when I'm looking at the human body, I like to start top, down, outward, and in. And that's for every male, female that walks into my room. And then we'll move down to the neck and or décolleté if that's an area that bothers you as well. We certainly do body treatments. So if there's an abdomen, like laxity in your abdomen or thighs that you want to look at, or even arms, is great paper that just came out with MERS, hyperdilate radius in the arms. So those are all areas we can address. And I'd like to know ahead of time. So when you fill out your paperwork, there's other areas of concern. We'll know that, and my MA can then have you unrobe and place a garment over yourself so the appropriate body parts are shown, and we can assess and go from there. So, what you can expect to leave with is a clear, prioritized plan. What we like to have for our patients, you're going to leave with this sheet here on the left-hand side. On the left-hand side, it's a little peel pad that we will fill out for you, and you get to walk to the front desk with, you get to take home. And this is going to highlight if what modality you may need. So whether that's going to be a laser treatment, microneedling treatment, melasma therapy, a general facial. So we might recommend our memberships because our monthly membership program is really designed to give you an outcome. If we're trying to really move the needle, we want to see you ideally monthly to clear up skin and then add in some injectables, a little bit of laser light therapy, maybe surgery in a year or so. So you're going to leave with that information. On the middle page of the page, we've got injectables. So I'm going to recommend neuromodulators every 3 to 4 months, depending on your goals. Almost everybody wants to come back every 3 to 4 months because they want to maintain the results. Even if you have light wrinkles, you don't have deep static lines that need to be completely eradicated. Everybody loves the results of a neuromodulator because it relaxes the pore size. It makes the pores look a little bit smaller. It helps reduce sebum or oil production in the skin, and it just gives you like a nice overall glow. So even my patients who don't have deep set-in lines, they love the effect just because of the glow of their skin. So I'll always recommend that if that's the result that you're looking for, you're going to need to maintain that every 3 to 4 months. If you're more relaxed, don't mind if you have some wrinkling, a little bit of skin readiness, oiliness, great. Then let's see how your body metabolizes and breaks it down, and you might be back every 4 to 6 months, depending on what your goals are, right? This is all cosmetic, and so this is something that we discuss during the consultation process. And then from there, we'll highlight what type of fillers that we might use. We do have filler packages that I'll go over with that. I'll go over that with you afterwards. And if we decide we want a filler package, we write that on the lines underneath there. We also offer P-Tox, Clitoxin, P-Shot, and O-Shot, and that is through Emilio and Delina, our two sexual health specialized providers. So we would circle that and then refer you to see one of the two of them. And then underneath we have skincare. So we have AM, PM, and then we have a robust line of skincare that we'll recommend for you as well. And from there, you also might get recommended to see our plastic surgeon and or menopause and or functional wellness specialist. So to prepare for your appointments, let's say you've booked online, you know, you've seen us talk, you've seen this webinar, or you've seen one of our social media posts, you know that you think you would need something, maybe like you just feel lacking in the midface, or you feel like your jawline is just saggy and you're not liking what you're seeing. So you know you want dermal filler. You make that appointment with one of us. What I would love for you to do to start to prepare 2 weeks beforehand, if you are on any medications like blood thinning medications, hypertensive medications, any blood thinning medications, I don't want you to stop them without a prescriber's approval. So if you have a history of blood clots or AFib, which is an irregular heartbeat or heart rate, I want to make sure you don't just stop those blood thinning medications. Uh, you can talk to your cardiologist if you're incredibly concerned about bruising and ask if you can pause it. If they say absolutely not, because this is cosmetic and your heart rhythm is much more important, that's not a problem at all, but please do not stop therapy on your own. That's really important. For me, I can help prevent bruising or mitigate. I can't prevent bruising, but I can mitigate the bruise once I see it start. Lots of pressure, cold compresses. We can work around that. It's not taking blood thinning medication does not preclude you or prevent you from getting the treatment itself. It just means that you probably will bruise and the healing phase takes a little bit longer. But I don't want you to stop those medications by yourself. If you do, bruising is a big concern. Talk to your prescriber, please. Otherwise, I do want you to pause blood thinning supplements what are not prescribed, such as fish oils, vitamin E, ginkgo biloba, and high dose garlic actually really do thin your blood and make you bleed more. So I love to mitigate bruising if I can for you. I love when patients will say, oh my gosh, I never bruise with you. I try not to, but it's not really me. It's really a lot of it is what's going on in your own body, how well your body is able to clot and stop yourself from bruising. And then please skip any elective dental work. That's going to be really, really important that you skip elective dental work 2 weeks prior and 2 weeks afterwards. People ask me about this all the time. If we're filling the face with hyaluronic acid, which is essentially sugar water, and you're having dental work done at the same time, there are tiny, tiny little micro breaks in the capillaries of the gums. Gums bleed quite a bit, and that bacteria from your teeth can get into your bloodstream, and then it circles around the filler that was just placed, and then we have a problem. So then we could develop an issue with nodules and or infection around the filler, because filler is sugar water and bacteria loves sugar. So we want to prevent all of that and make sure that you don't have a poor outcome. A week before, avoid aggressive skincare in the treatment area. I'm kind of calling this out to some of my ladies who will try to peel off wrinkles with their tretinoin. I've had a couple of patients come in and their skin is just red, raw, peeling. Sometimes it's weeping because they're trying to get ahead of lip lines or neck lines. Don't do that to yourself if you can, for a couple of reasons. One, you can get impetigo, another infection, and you can hyperpigment just from the irritation alone. But more importantly, it also, for my treatment, it obliterates my canvas. So because you're red and swollen, I don't see the nuances. I don't see the light wrinkling in the skin that I could correct if the swelling wasn't there. So that's why I recommend just holding off on anything aggressive. Avoid waxing in the area right before. And I say waxing just because of lifting skin. So if your waxer accidentally lifts skin because you didn't stock retinol, for example, it will cause a superficial infection, and then we won't be able to fill you that day. Reschedule if you have an upper respiratory illness, any viral infection going on, even a urinary tract infection. If you have right now, if you have bacteria flowing through your body and your body's just trying to overcome any type of illness, please don't get dermal filler. Get better. This is elective. All of this stuff can wait until your body's at the optimal point for the selective treatment. We want to inject in a healthy body. And then 24 to 48 hours prior to your treatment, no alcohol, no aspirins, no ibuprofen or NSAIDs. Tylenol is fine, but if you can skip really heavy duty intensive exercise an hour beforehand, I would love that. Arrive with a clean face and makeup free skin if you can. Otherwise, I'll cleanse it for you. But the reason why this is where it gets a little bit tricky. I do recommend patients, if you are an avid exerciser, you have to take those classes and you have an appointment with me, let's say 9 a.m. Please take the class if you can between 6 and 7 a.m. Your heart rate is still quite elevated. Your blood vessels are dilated, meaning bigger. And so that just means you're likely going to bruise quite a bit more. I always say my summer months are my bruising months for patients because they come in from outside, they walk to our clinic, or it's just been warm outside. Their face is red, they're warm, sweaty, and their blood vessels are much wider than they would be in the winter months. So you just tend to bleed a little bit more and bruise a little bit more. So even like a Botox, a neuromodulator appointment that you normally wouldn't bruise in, that's when you're gonna get a bruise is when the warm months. All right. And so, what do we do if we get a bruise? First, don't freak out. It's normal. Everybody gets a bruise. It can happen. It is not a complication. It is a well-known risk and can happen. Good news is it means you're alive. That's what I tell everyone. If you're bruising, it means you're alive. Great. But what we can do at home is you can take arnica, you can take bromelain to help clear out the bruising. Foods that you can eat are going to be anything with capers, red onions in it, and pineapple. That's very high in bromelain. I just had surgery 2 months ago, and I had spinach, um, pineapple smoothies, and protein every single day, and blueberries, spinach, blueberries, pineapple, and some Greek yogurt. And I healed so quickly, barely bruised. I was very, very, very happy. So I highly recommend that for your neuromodulator and filler appointments as well. After your appointment with a neuromodulator, so our neuromodulator go through a phase, it's called endocytosis, where the body will actually gobble up the active molecule of your tox, so your neuromodulator. So after about an hour, that happens. Before that time, you can technically still sweat it out. You could theoretically massage it into an adjacent muscle that we don't want and cause an eyelid droop. So the first, and an abundance of caution, we will say the first few hours, 4 hours max, but within that first hour, it goes through endocytosis on a normal temperature day. We want you to avoid touching that area. Don't go into a sauna because we don't want you sweating. I am okay with the way I inject. You can lay backwards, but not on your face, right? Laying backwards, if you're injecting appropriately, is not going to go into a deeper area of the face than you intended for it to go. But that's something that's really important for us to know. Okay. All right, let's talk a little bit about some of our filler packages. We have quite a few different options for patients. The reason why we develop these filler packages is because, as a lot of you know, unless you're only injecting lips, one syringe is really not enough to address full face at all. And now that we know so much better, we do so much better as well. We know how much temples take. We know mid-face takes multiple syringes. Temples takes anywhere from 2 to 4 syringes minimum. Like that's a starting point. Cheeks will be anywhere from 2 to 4 syringes as well. Piriformis is usually one syringe. Chin could be anywhere from 1 to 3 syringe for a woman. For a male, anywhere from 3 to 7 syringes, depending on how much of that jawline we're trying to build out. So we develop these packages as a cost savings, but really for us to also be able to address all of the patient's unique needs. So on this left-hand side, this is a package of prominence and pout. So that's mid-face and lips. And this was one of our models for our new Obagi Magic dermal filler that we were fortunate enough to trial and do a little mini study here at Fulcrum. The next one was with, it's actually one of the models for Allergan, and it's portions perfected, and it's under eyes, cheeks, lip, chin, and pre-jowl. The next patient is our Serene and Sculpted. So for her, I did a blend of hyaluronic acid, Sculptra, PLLA, and neuromodulator for her. And you can see her before and afters. Artful angles. Artful angles is this is a patient on the left-hand side. And yes, guys, men do it all the time as well. And for men, we're really focusing primarily on jawline and mid-face, where they tend to drop off in the anterior medial cheek. So for this gentleman, we focused on artful angles, which was mid-face, jawline, and a little bit of lips as well for him. In the middle, I used the Portions Perfected package, and for her, we focused under eye, chin, cheeks, and lips. And then our beautiful Delina, she was our regenerative package, which I used a blend of PLLA in one visit, and then MERS product, which is Radius Kaha, in another visit, and also PDGF to her under eyes. This is another male jawline who, this is Parker, that we did not do the full artful angle package, but we did full jawline on him. We just didn't do his lips. He didn't need lips. In the middle, we did prominence and pout, and that again is going to be our cheeks and lip package. And then to the right, we did our regally refined, which was her cheeks, piriformis, lips, pre-jowl, and then I had her come back for a second regenerative package of just general sculpture overall. And in between this, before and after, she also had an upper bluff by Dr. Hill. Speaking of Dr. Hill, here is his men's Dysport before and after. He's my husband, so I like to take away a scowl. There's no scowling in the house allowed. And in the middle, we have a patient. There's a lot going on, which is really fascinating on social media. A lot of misinformation saying never ever fill a nasolabial fold. There are no absolutes in aesthetic medicine. And if a patient needs it, they need it. You just need to be smart and know how to fill them so they don't get bulky and they don't get, have a poor outcome. So this is an example in the middle of a patient who really did need, she had some more maxillary retrusion. So she needed piriformis, and then she needed a little bit of HA filler along the smile line. And you can appreciate just along her nasolabial fold, how much of an impact that made. And then all the way to the right, there are patients I thought she was a great example. She's got very full lips. She's a beautiful woman. And if you were to look at her first glance, you would say, why should she doesn't need filler at all to her lips. Her lips are so full. But what she benefited from was some balancing to her upper lip. If you look at her upper lip in the top image, it's very flat. The ergotrid or the upper lip is flat. It goes straight down. There's no nice slope. And that we like the ergotrid to have a slope on the profile view. That's a sign of youthfulness. A sign of aging is the lip dropping like this. And so what we create with dermal filler is a nice little slope on the side. And so for her, we just did one syringe to her lip. And interestingly enough, when you have full lips, you actually require more because the surface area is so wide. In order to see a result, you generally need more to see it. So something fun little fact. And then I want to talk to you guys a little bit about cost expectations. We are big on transparency. So for our filler packages, we start with the prominence and pout. $2,500, regular refined, $2,800, portions perfected, $3,650, pristine profile, that is with a non-surgical rhinoplasty, and these we book with Dr. Hill only. So pristine profile, this whole package is with our plastic surgeon. Nobody else on staff does NSRs, non-surgical rhinoplasties, except for Dr. Hill. So if you're interested in pristine profile, please book with him. Artful angles is $4,250. Serene and Sculpted. So again, that's your blend of hyaluronic acid, Sculptra, and neuromodulator, all in one, 3,600. Our regenerative package, so that's going to be 3 visits across and 2 vials per visit, 4,800. Graceful Grip is for our patients who are starting to see aging in their hands and they would like some dermal filler to help conceal the blue color of the blood vessels in your hands, and or you can start to see the skeletal system and see the bones in the hand as well. So it's really nice. And then Booty Boost is for our patients who would like a little extra enhancement in the buttock region, especially in summertime. It's quite a popular treatment, and that's $5,400. In addition to it, that if you're going to book the Booty Boost, I highly recommend you book our Booty Buffer booty facial right afterwards upstairs with our estheticians. They can make sure that all ingrown hairs are cleared. We are offering because of the combination treatment, but we're giving an additional 10% off that already markdown filler packages. With any of our injectors, besides me, we are building out our team who is absolutely amazing, talented. They inject me, they inject David. We trust them so much with our faces, and we trust them with yours too. And so what you can do is schedule by June 12th and just include filler masterclass in your booking notes, and you'll get an additional 10% off the filler package, which we never do because it's double dipping, but we're doing it for you. You can text to schedule if you are interested. And then please be sure to tune in next week to see our dear Nikki, who is Dr. Hill's patient coordinator, and she's going to talk to you all things Alloclay. If you're curious about fat transfer and, well, Alloclay, which is a cadaveric fat that is injected, this is great for patients who aren't eligible for fat transfers themselves, meaning from their own body, autologous fat transfer, because usually you're a little bit too thin, you don't have much fat on your body, or you're just a patient who knows you do not want surgery at all. You don't want that downtime, but you want the result of what a fat injection can give, which is a little stem cell and permanent volume. Please tune in, and Nikki's going to show you some beautiful before and afters that Dr. Hill has created with our patients. Thank you so much. And then I am going to, oh, for some reason I cannot. The little arrow is not sweeping up. Erin's going to help me because she's our tech. Oh my goodness. Wow. If there are any questions, I'm going to take a peek here. Oh, great. So we have a question. Do we offer 3D analysis for the scalp? Do we offer 3D analysis for the scalp? We do not, because we don't have a scalp reader. For the scalp, that is more of a head spa. That is, those machines are made to actually look at the hair, the follicular units themselves. Our machine does not analyze the scalp at all, unfortunately. Wish it did, but it does not. Okay, beautiful. That one is done. And if you guys have any questions, go ahead and shoot us some questions. Otherwise, I am going to hope I answered all of them really clearly for you. I have another one. How long would the graceful grip package last? That's a great question. So for dermal fillers, what we tell you is when the study stopped. Like this dermal filler lasts around 12 months. So this filler for graceful grip package The studies for this product, not in the hand, but for this product in the face, have stopped, and we usually will use hyperdilute radius in this area, stopped around 12 to 15 months. And so we'll say they last up to 12 to 15 months. Anecdotally, what I see in patients that I fill with hyperdilute radius in the hands, I typically don't need to fill them for 2 to 3 years. It just depends on your body, though. Everyone's different. And it also depends if I was able to correct you fully in the initial treatment. So sometimes we'll add graceful grip, like we'll add filler to the hands, and let's say they needed 2 syringes, but we just did one because they were pretty happy with one. And you get anywhere from like a 60 to 70% improvement. They're like, great, I'm good enough with that. You might come back at about a year to a year and a half for a refill because we didn't do 100% correction. If we fill to 100% correction, I have found in my patients, they last much longer. Filler in the face, and we'll tell everybody it lasts up to 2 years, maybe 15 months, depending on the type of filler. But filler in the face, I have seen last years, 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 and years. So anywhere, 15 years or more, depending on the area that I was injecting and the quantity that was injected and the type of filler, of course. Of course. All right. Perfect. All right. Well, thank you very much. And I hope to see you guys all next week with Nikki's.